Hi guys, it's Dr. Denny over at Four Paws Up Culture Veterinary Clinic, and today Ashley and I are going to be chatting a little bit about everything you need to know about dog medication. So she's going to get us started by asking some questions.
Dr. Denny, how are medications used to treat my dog?
So it depends on what conditions we're treating, right? But medications are used to treat certain conditions like pain and inflammation, pain in general, muscle relaxers if you've hurt, and maybe if the back's hurt, antibiotics for infections. So it's going to be conditions like that, things that are treatable by medications is what we're going to be using them for.
What are commonly used medications for my dog, and when would the veterinarian recommend them?
So if we have hurt, like if our pet has been hurt, or dog has been hurt and is limping, and maybe we diagnose something like a strain or a sprain, then we're going to use pain medications like maybe like gabapentin, which can help with nerve pain, anti-inflammatories. Sometimes we'll even use medications that are in the narcotic family, like buprenorphine, which is a kind of a variation off of morphine. So we have strong pain meds just like they do in human meds. We can use antifungal medications for yeast infections, ringworm. We can use antibiotics to treat bacterial infections, which can happen anywhere. So, skin, ears, urinary, liver. I mean, bacteria can go everywhere, right? Anti-parasiticides. So if your dog has intestinal parasites or heartworms, then that's something that we can treat and even talk about, preventing. If your dog has been diagnosed with cancer, then there are certain chemotherapies that can be used to try to get your dog into remission. So there's a lot of different options when it comes to medications, just like there is in people. I think you can also there's some metabolic diseases that we can treat, like where the body is making too much cortisol, and we can tell the body not to make as much cortisol. What about if your dog is super anxious and has behavior problems? There's medications that are anti-anxiety, antidepressants, behavior modification medications that can help your pet kind of get out of their own head to where they're not so upset all the time, or to help with training.
What are some of the side effects and adverse reactions my dog could experience from these medications?
So it's going to really be dependent on what we're giving. But I would say for anti-inflammatories, the most common is going to be tummy upset. So you always want to give these with food, always with a meal. But you can see either vomiting or diarrhea. If either one of those side effects are seen, you have to stop the medication and call us. Some of the pain therapies that we use can cause sedation or drowsiness or vocalization. Those are all normal. Medications like steroids, which are treating inflammation or autoimmune diseases or etc. These can have quite a few side effects. So steroids can make your dog drink more, pee more, be more hungry, pant, be a little more irritable, and long-term steroids can cause weight gain and elevated liver values. So there are side effects to every medication. It's our job to make sure we're using medications that are appropriate and that we do talk about these side effects. That way you're prepared for them.
What do I need to know about drug interactions?
So, drug interaction is where we want to make sure that everyone plays well in the sandbox together. Okay. So, I'm not going to put two drugs in the sandbox that are not going to get along. Okay. Those don't need to go together. So, for instance, I don't ever prescribe oral steroids with an oral anti inflammatory. Those meds do not play well in the sandbox together. So, that is that's my job. I get people that ask me all the time, well, is this safe to give all these medications? And my response is I would never tell you to give something that would put your pet in harm's way. Like if I'm telling you that these drugs can be given together, that's because they play well in the sandbox together. If I'm telling you that, hey, we can't give these drugs together or we need to be cautious, it's because maybe they don't know how to share in the sandbox and they don't play well in the sandbox. But that's going to be something that, that's a conversation that we have on certain conditions that I will have with you.
Can my dog be on medications long term?
Yeah, of course. So we have long-term conditions like osteoarthritis. That's not going anywhere once you have it. It's there. So like long-term anti-inflammatories, absolutely. Allergies are another big one. So we cannot cure allergies. We can only manage them. So long-term medications to manage allergies, absolutely. If your dog has chronic back pain, Them being on back pain medications long term is going to be, forever. If your dog has an inflammatory bowel disease, then yeah, periodically we're going to be on long courses of medications, very similar to humans. Like I have acid reflux really badly, and guess what? I will be on an antacid for the rest of my life. And so, like, it kind of translates from humans to dogs.
Why is it important to not give my dog medications without speaking to the veterinarian first?
Because what if you're giving something that's toxic and would hurt your pet? So please don't administer medications that have not been under the direction of a veterinarian, because you could make things much worse for your pet. And while you may be trying to save money in the short term, if that is toxic or has a massive reaction because you did not go to veterinary school, I did. And so you may not know these tiny side effects that I was taught in school. There's a whole reason I was in school for 10 plus years. I went to school. This is my lane. You don't want to make something worse. So you don't want to be like, okay, well, I'm trying to save a buck by not coming into the vet clinic, and then all of a sudden my dog's now having bloody hemorrhaging diarrhea, and now I'm in the hospital your dog's in the hospital for 3 or 4 days, when a simple phone call would have been, hey, please don't give this to your dog because XYZ can happen, and we could have avoided the whole thing.
What tricks can I use to give my dog medications?
That's a good question. I feel like some dogs are ninjas, and even some of the smallest dogs can be the hardest to medicate. You think that's going to be so easy, this little 5-pound chihuahua, and it turns into like this wiggling and no one can get meds down. So this is a great question. I would say using food is probably going to be the best way, especially if your dog is food motivated. So maybe a little tiny piece of cheese, or they make pill wrap, or like pill pockets that you can get from Amazon or any pet stores, to hide the medication. If that's not working, see if we can get the medication compounded for you into a capsule and or a liquid. If that's not working, then try double wrapping the pills. So with my husband's dog, she's a ninja when it comes to pills. So she will find the pill, and it is like amazing how smart this dog is. So I have to double wrap. So I do a thin layer of American cheese, and then I cut up a hot dog into like eighths, and then I put the American cheese coated pill inside of the hot dog. And usually that'll get it down. If that fails, then poor girl is getting her mouth shoved open, and I'm going to shove it down her throat. There are YouTube videos demonstrating like how to shove a pill down, but obviously we want to try to avoid this, just because you could get hurt and your dog's going to start to not appreciate you when you come at them with a pill. So food's going to be the best. And if you're still struggling, we do actually have clients that will come up where we actually will help them medicate. So don't think that that you're alone. Don't think that, there's something wrong with you. Like, this can actually be really difficult. Okay, go ahead.
Last question. Where should I get my dog's medications refilled?
So you should be going through your veterinarian. So you want to make sure you call when you have about a week's worth of meds left. Don't ever wait till the last minute. Unfortunately, we have clients that call that are like, oh, I'm leaving out of town today. And I'm like, well, I can't drop everything and fill this medication right now. We try. But you have to remember that, failure to plan does not constitute an emergency on our part, because we are actively seeing patients, and sick patients at that. So it's hard for us to drop everything and get a medication filled for you right then and there. So make sure that you plan. Please call a week before you're out of meds, or a week before you're going to be going on vacation, so we're not down to the wire, so you're not upset with us, and we're not having to try to take care of patients and also make sure that our clients are happy, because we do want to help, but we have to be realistic here and make sure that there's not a failure to plan. So I hope this helped answer some of the questions you might have about dog medications. If you are worried your dog is experiencing a side effect to something, please give us a call, and we're here to help. Thanks, guys.